Knock knock. Hi, I'm Capri. I'm gonna be your nurse today. Can you state your name and date of birth for me?
Leah Ragnauer, 6/21/01.
Okay, hi Leah, nice to
Hi.
meet you. Today we're just gonna be doing a head to toe assessment, and this is my paper.
Okay.
So I'm just gonna set it over here.
Okay.
I'm gonna wash my hands.
Okay.
And can you tell me where we are right now?
Saginaw, Michigan.
And can you tell me the year?
2021.
Okay, good job, thank you. I know that, that's weird, but we ask everyone.
Yep.
And then can you tell me, do you take any medications?
I take propranolol for my heart rate, but I just went to the doctor and everything was all good.
Okay,
and then
so you're all set with that.
Yep, and I take birth control.
Okay. And then, do you consume alcohol at all?
Occasionally.
Okay.
A couple
and then-
times a month, probably.
Okay. And then what about smoking?
I don't smoke ever.
Okay. And then have you had any surgeries in the past or anything?
Nope. I had my wisdom teeth out, but that's it.
Okay. And then how would you say that your diet is?
Pretty healthy. I try and eat 3 meals a day and not snack.
Okay, that's good. And do you like to exercise at all?
Yeah, I try and get outside and go for a walk at least once a day.
Okay. Is it alright if I just get some vitals on you?
Yep.
I'm gonna start with your blood pressure.
Okay.
Do you have any pain today?
No.
Okay. And do you have any questions or concerns that brings you here today?
Nope.
Okay.
Just a checkup.
Sorry.
That's fine.
Squeeze in there. There we go. There you go. Is that okay?
Mm-hmm.
Okay. If you want to set your arm
It's
up
probably
here,
gonna
you
need
can.
to be a little tighter. Just because it's falling down. This,
It's kind of sticky.
yeah, this cup is not the best. There we go.
All right.
Thank you.
You're welcome. Can you get your arm right here for me?
Thank you.
Give me a little.
Somewhere.
And then I just need to see this. Are you comfortable?
Yep.
Okay. Thank you.
Mm-hmm.
Okay. I'm just gonna give your arm a rest.
Okay.
There you go. And then I'm just gonna take your pulse really quick, okay?
All right.
Are you still comfortable?
Mm-hmm.
Okay. Your pulse was 70 and your respirations were 15. And those are both within normal range.
Okay.
And I'm just gonna finish up your blood pressure really quick.
Okay.
Thank you for holding up.
Mm-hmm.
It's kind of stuck. Okay, so your blood pressure was 110/80, which is a little bit low, but that's okay. I see that you're
Pretty
nice and
normal for
comfortable
me,
here.
yeah. It's
Okay.
from my propranolol, I think.
Okay. Oh yeah, and you did say to take that, so.
Yeah, so
Okay.
that's normal.
Okay. And then I'm just gonna take a look at your arms and hands, okay?
Okay.
Are you comfortable?
Mhm.
Okay. So I'm just checking to make sure that like your temperature is equal throughout, and that your muscle tone is the same throughout also. Symmetrical. And then I'm gonna check your brachial and your radial pulses, and those are also symmetrical.
Okay.
And then your hands, if I could just take a look at those really quick. Okay. I don't see any clubbing, and that'll be normal for you.
Okay.
And then your gap refill is less than 3 seconds, which is also normal. Okay. And then I'm going to take a look at your head, if that's okay.
Okay.
Can you take your hair down for me?
Yes.
Thank you.
Mm-hmm.
Oh, you have pretty hair.
Thanks.
Okay. You haven't had any like breakage or like fall of your hair at all, have you? Okay, I'm just gonna run my fingers through it. I don't see any shedding, which a little bit would be normal, but and then just tell me if you have like any pain, okay?
Nope.
Nope.
Nothing.
Okay. Okay. And then while I'm up there, I'm just gonna check to see if your lymph nodes are all normal, okay?
Okay.
So I'm gonna start with occipital, and then I'm going to do post-auricular and pre-auricular, and then submandibular and segmental, and then your cervical chain is all good, and then your supraclavicular, all normal, and then I'm going to check your sinuses, your frontal, and your maxillary, and then I'm just gonna pull up your eyelids. Can you like look up or down for me?
Yep.
Thank you. And then I'm just gonna take a look at your ears, okay? Okay. I see that you have piercings. Do you have any problems with those at all?
Nope, they're pretty old.
Okay. No pain or tenderness?
Nope.
Okay. I'm just checking your pinna. They're not red or anything, so I think that's okay.
Yep.
I'm just gonna take a look at your eyes for me.
Okay.
Actually, I'm gonna check your trachea really quick, okay?
Okay.
Which is also your windpipe, to make sure that it's like not like movable or that it doesn't hurt or anything.
Okay.
You're okay?
Mm-hmm.
Okay. Now I'm gonna take a look at your eyes.
Okay.
Okay. And then I'm going to have you just like look at the pen light and then follow it with your eyes, but don't move your head, okay? Okay. And then I'm going to have you look at the pen and then look at an object behind me.
Okay.
Okay. So that was your cardinal field of gaze and your perla, which is your accommodation. And everything looks normal. For that. So now I'm going to look at your nose.
So why did you have to do the cardinal field of gaze?
That tests your ocular motor, trochlear, and abducens cranial nerves.
Okay.
Okay.
So that was okay.
Yeah.
Makes sense.
And then I'm just going to look in your nose, okay?
Okay.
Okay. Doesn't look abnormal or anything. Your mucosas are pink and there's no like polyps or anything, like little bumps. You don't have any pain there or anything?
Nope.
Okay. And then I'm just gonna look in your mouth.
Alright.
I'm just gonna put this on your tongue.
Okay.
And I see that your hard and soft palates are good. It's pink and everything. And then can you stick out your tongue for me? Okay. That is your hypoglossal cranial nerve.
Okay.
And then can you open your mouth and say ah for me? Okay. And that is your vagus and glossopharyngeal cranial nerves. Okay. And then I'm just gonna have you close your eyes for me.
Okay.
And then can you smell this? And tell me what it is.
Cinnamon.
Okay, and that is your olfactory cranial nerve.
Okay.
And then I'm just gonna put this on your face. And can you tell me where I'm touching you?
Forehead. Left cheek. Right cheek. Chin.
Okay, and that tests your trigeminal cranial nerve.
Okay.
And then I'm just gonna place my hands on your chest, and can you clench your jaw for me? And that's also your trigeminal cranial nerve.
Okay.
Okay, I am going to. Oh, sorry, actually. You're itchy?
Yeah.
Okay. I'm just gonna put my hand on your shoulders, and then can you just like make this motion for me?
Yep.
Forward and backwards. Okay, and then backwards. I I did hear a little bit of cracking. That's called crepitus. Is that normal for you?
Yeah, I hurt my arm in softball.
Okay. Can you do it for this arm? Okay. Thank you. I'm going to check my sheet really quick before I move, okay?
Okay.
It looks like the only thing that I might have forgot was to look at your sclera. Well, I did, but I didn't mention that it was white and there's no signs of like yellowing or anything. And then I think that's all.
Okay.
So I'm just gonna have you sit here for me, and then face the couch. And so back here, I didn't check your tissue trigger from the front, but I can just do it right here.
Okay.
It looks like you're all good. And that's just like signs of dehydration or anything, okay?
Oh, okay.
So I am just going to listen to your back, your lung sounds, okay?
Okay.
So then can you just take deep breaths in for me?
Yep. Do my shirt.
Yeah, if you could, please.
Do it up, off. So,
Just like right here is okay.
Okay.
And then I'm just gonna check for symmetry. And you said you don't smoke or anything, so I'm just gonna, when I listen to your lungs, I'm gonna start from the top, but I would start from the bottom.
Okay.
So I'm just gonna place my hands here, and then can you take a deep breath for me? Okay. Sorry, my hands are cold.
It's okay.
And then I'm just going to listen to your lung sounds, okay?
Okay.
And then if you need a break, just let me know, okay?
All right.
Is it okay if I lift this up a little bit?
Yep.
Okay. Sorry. Doing okay?
Yep.
Okay. Thank you. And then I'm just gonna check for a barrel chest really quick, okay? I think I can pull this down for you. So right here, rib to rib, and then front to back should be 2 to 1. And you are also 2 to 1, but people with emphysema and stuff have barrel chest.
Okay.
But you do not have that. So I think I'm going to check my sheet one more time before I have you lay down, okay? So I just forgot a couple things.
Okay.
I'm just gonna move your thyroid over a little bit and then have you swallow for me, okay?
All right.
This side? Okay. And then I'm just going to percuss your back, okay?
All right.
Is that alright?
Yep.
I'm just gonna lift this up a little bit. Awkward position. Okay, and then over your lungs, I should have heard resonance, and I did, so that was good. And I think I'm ready for you to lay down.
Okay.
you comfortable?
Yep.
Okay, so having like, see me here, I don't see any JVD or anything. And if I did, I would expect the JVD to go away with a 45-degree angle.
Okay.
If I had a bed here to lift you up. So I'm just gonna listen to your heart sounds, okay?
All right.
I'm gonna listen with both sides of the stethoscope so that way I can hear for any heart murmurs or anything, okay?
Mhm.
Okay. My yelling poses. Okay, so I'm gonna start with the second intercostal space right of the sternum, and that's your aortic. Correct. Okay, I'm gonna listen with the other side. Okay, and then pulmonic is the second intercostal space left of the sternum. Other side. Okay, and then herbs is the third intercostal space left of the sternum. You got a strong heartbeat.
Do I?
Yeah. Okay. And then if I could just have you lift up your shirt a little bit for me. And then this is your tricuspid, and it's the fourth intercostal space, mid-clavicular line. Okay, and then I'm just gonna listen to your mitral, which is the fifth intercostal space left of the sternum. Okay, other side. Okay, and then I'm just gonna listen for 1 full minute, and this is your apical pulse, okay?
All right.
You doing okay? You comfortable?
Yep.
Okay. So that's your most accurate like pulse or heart rate. And for that one I got 79.
Okay.
So it's around the same as when I took your vitals earlier.
Yep.
So now I'm just going to take a look at your abdomen, okay?
Okay.
So first, I'm gonna inspect
Perfect.
as best as I can from down here. Okay, and I'm looking for like any lesions or adipose tissue being unequally distributed.
Okay.
And I don't see any of that, so I think we're okay. And then I'm just gonna take a listen to the arteries that you have, like in your abdomen, if that's okay. Well, first I'm gonna listen for gurgles.
Okay.
And I'm gonna start with the right lower quadrant. Okay, I heard 5 gurgles. Did you eat today?
Yep. I just ate.
Five gurgles. And and then more than 5 gurgles there.
Yeah.
And then I'm just going to listen for any bruise or whooshing sounds that you would have. And I didn't hear any heart murmurs up there either. So I'm just going to check here. I'm going to start with your aortic, with the bell. And then your renal on the right. Renal on the left. And then iliac on the right. Iliac on the left. Okay. And then you do have arteries like right here. It's called your femoral arteries. Can I just take a listen?
Yep.
Okay, other side. Okay, all good. And then I am going to...
Oh, sorry. I'm just cold.
I'm going to percuss your abdomen, okay? Oh, sorry.
Oh, I'm sorry.
Stepping on you. Okay. And just let me know like if you feel any pain or anything.
Okay.
I'll do that too. So I would be here listening for tympani over everything except for like right here, which is your liver, which is dull.
Okay.
Sounds good to me. And then I'm just going to lightly palpate your abdomen, okay?
Okay.
So just let me know if there's any pain or tenderness. I see you have a tattoo here. Does that give you any issues?
Nope, I feel pretty well.
Okay. And I'm just gonna like push a little bit deeper.
Okay.
Just let me know if there's any pain. Okay. I think we're all good there. I'm going to take a look. No, not. I'm gonna do your legs next.
Okay.
Are you cold? Are you
Yeah,
all set?
it's
Okay.
just cold in here.
I'm sweating. So I'm just gonna take a look at your legs the same way that I did with your arms.
Okay.
I'm just checking to make sure that they're all, for you, cold throughout.
Yeah.
And then your muscle tone. And then check for edema, which you don't have any. And then you also do have, like pulses or whatever you want to call them, in your legs. So I'm just gonna check your knees here and then your feet, okay? And so this is your popliteal. And I'm just checking for symmetry. They're both symmetrical. I'll do this. And then this is your posterior tibialis. And then your dorsalis pedis. That sounds good to me. And I'm looking for something. Just 1 second. I think my photographer might be sitting on it, maybe. Right here. Sorry, photographer. I'm just going to put this on your leg and you tell me where it is, okay? And if it's sharp or dull. So this is what sharp feels like.
Okay.
And this is dull.
Okay.
So you can close your eyes for me. And then just let me know where it is and what it is.
Dull right thigh. Sharp left thigh. Dull left shin. Sharp right shin. Sharp left top of the foot. Sharp right top of the foot. Dull bottom of the left foot. Dull bottom of the right foot.
You got all of them right, so that's 8 out of 8. Just checking your like sensation or
I was
anything.
not very confident.
Just checking like your sensation in your legs. Some patients that have like diabetic neuropathy or anything probably wouldn't feel that as good as you did.
Okay.
Okay, so I think I'm gonna check my sheet one more time.
Alright.
Before I have you get up for me, okay?
Perfect.
The only thing that I forgot is to palpate your femoral arteries that I already listened to, so that's okay. I'm gonna do that.
Okay.
Okay, we're all good. And if I could have you switch spots with my photographer.
Oops. Okay.
Just gonna put some hand sanitizer on one more time.
Alright.
And then, since I'm having you sit right here in front of me, I'm just gonna test your carotid arteries up here because I didn't do that at the beginning.
Okay.
And she can measure with this one. Okay. Okay. I'm just gonna listen really quick for the bruise that I checked in your abdomen and stuff.
Okay.
I think you're all good. So I'm having you sit here in front of me. Can you just take your hands from me and then go like this back and forth as fast as you can. Okay. And then okay. So that's just testing your cerebellum function.
Okay.
And then can you do this motion? Okay. So I think that's good with your arms. It's just checking your range of motion and stuff.
Okay.
So I'm gonna move to your legs really quick. Can you swing your legs in and out for me? Okay. And then, okay, back to your hands real quick.
Okay.
Can you like push against me whichever way? And then up it. Okay. And then I'm gonna do the same thing with your legs.
Okay.
And then feet.
Kind of.
Your feet are cold.
I know.
Is that good for you?
Yeah, it's normal.
Normal.
It's cold in here.
Oh, okay. So before I stand you up, can you put on your shoes or do you need help?
I can put them on.
Okay. I think these are yours.
The bug bite.
Okay, so then I am going to have you stand up. And then, oh, you're tall. Can you just stand up with your eyes closed for just a few seconds? Okay. And that is called the Romberg test, and that tests your vestibulocochlear cranial nerve.
Okay.
And that's number 8.
Alright.
And I'm deeming you safe to walk. So if you could just take it like 10 steps forward for me, or just a few.
Yeah, we don't have too much room. Is that good?
Yep.
Okay.
And then on the way back, just do heel to toe for me. Okay, and then you can either stand or sit, whichever one you prefer. Okay, so that is the end of your head to toe assessment. And for your Braden scale, which is a scale that tests like your risk for pressure ulcers or bed sores, whichever one you know them by, I would give you 23 out of 23, which is the highest score that you can get, because you're pretty active and you eat pretty good. So I don't see you sitting in bed all day or like banging your elbows on things that are gonna make you get pressure ulcers.
Okay.
And your skin's not like super wet or anything. So
Alright.
yeah.
Thank you, Capri.
Thank you, Leah.